When their stress level is high, they cannot perform. So that also leads to infertility. Even long-term use of antacids, antipsychotic drugs, they all have some effect on the male infertility. Or primary ovarian insufficiency is when you have an ovarian failure at even a younger age. So,
thank you for agreeing to do this with us.
Okay.
I'll introduce myself. My name is N. Jamir. Friends call me Jamie. Okay. I work for Subhak Health Tech. We have got two products which in the infertility market, which one is the underwash machine, which is a sperm preparation machine. And then the other one is V-Conceive, which is a home insemination kit. So for our viewers' benefit, would you kindly introduce yourself, Dr. Gayatri?
Yeah, I'm Dr. Gayatri Gokul from Madurai, South India, Tamil Nadu. And I have my own IVF center, and I have been in this field for the past 13 years. And I do freelance also. So basically, I'm an IVF specialist who's been treating infertility patients for the past 12 years as a super specialty.
Okay. So when you say freelancing, you go to different doctors as per their requirements and then you give your services?
Yeah. As pick up ET, they call me if they need help and I go and I help them and come.
Oh, very interesting. That's the first doctor that I'm meeting who's into that kind of thing.
Okay.
So, Dr. Gayatri, in your words, could you explain to us what infertility is all about and how the terminology is changing over the years?
So, infertility is basically, as per the definition, where a couple, they fail to conceive within 12 months of unprotected intercourse. So initially we used to see very less cases, but now I think because of all the population burst, or women and men, they want to get married late because they want to settle down in life, or women are more career oriented, or we see a lot of second marriages at very late age. So because of all those reasons, nowadays it's on the rise.
Like marriages, lifestyle choices.
Exactly.
Right. So over the years, I'm sure in your 12, 13 years of practice, you must have seen how the terminology is changing and how the patient demographic is also changing. So
yes, exactly.
For example, I learned recently that the word infertility itself sounds very negative, and therefore the doctors are choosing to use subfertility.
Subfertility or fertility specialist?
Acha, kindly elaborate if you can about this.
Yeah, sure. The thing is, when I started initially, I used to see women who come to me in their 30s, late 30s. But I'm seeing these girls who are coming to me within 21 years because of the lifestyle changes, and there is more awareness of male infertility now. Because initially it was all towards the female. Yes. You get married, you conceive after 5 or 6 years, you get a divorce and they get married second. But nowadays, it's basically like, you know, they come within the first year, and when you tell them, okay, let us do an analysis, we find more of male infertility. So male infertility has become, the awareness has improved now.
What do you think causes male infertility?
I think it is the lifestyle changes, or maybe their what do you call that? Their food habits, or even their job occupation, or any long-standing drugs. I mean, I have seen men who take a lot of antihypertensives from their young age. So they don't know that it is causing infertility in a very negative way. So early usage of drugs, which I think not many doctors are also aware, okay, this might cause infertility. So I have seen a lot of people, and maybe genetic, because some of the marriages I see are second degree consanguineous marriage or third degree consanguineous marriage. So because of that also, I am seeing a lot of males who have some chromosomal anomalies. So which obviously leads to infertility.
Very interesting. You said hypertension medicine, as in blood pressure.
Antacid. High blood pressure, or even long-term use of antacids, antipsychotic drugs. They all have some effect on the male infertility.
I also read somewhere that men who use a lot of laptop have lower semen count.
And nowadays you see a lot of stress, high stress levels in IT field where they have to meet their targets. So all those definitely causes infertility in another way. Like they don't have to really have reduced semen analysis. When their stress level is high, they cannot perform. So that also leads to infertility.
Oh yes, that's also true. That's something that, So now, over the past 12, 13 years of your practice, you have seen more of youngsters coming up to you for help because of raising awareness of male infertility. And you're also saying that there's more of there is a rise in male infertility these days.
Exactly,
It's very refreshing, right? Earlier, it was just the woman who was to blame. You get married. What exactly are the numbers that we are looking at here when we talk about infertility issues? Would you have a rough number?
I will say around 30%, definitely. See it as a global incidence, definitely around 30%.
I see. That's a lot.
Yeah, it's a lot. It's a lot.
I read in an article that for women, apart from the age being a factor, failure to ovulate is one of the other concerns or top-rated reasons why females fail to conceive.
Exactly.
Could you tell us in simple words what it means and how it affects women?
Yeah. Failure to ovulate, I have seen two categories.
Right.
One is your hyporesponders. One is the hyper responder. So as we are
hyporesponders.
And hyper.
Oh.
So I feel, and we all know hyper is PCOD. So when you have a hyper response to whatever stimulation we are giving, before stimulation, when they have PCOD, bilateral polycystic ovarian syndrome or disease, we all know that anovulation is one of the main factors. So when you feel that, normally on the 14th day of a menstrual cycle, women are supposed to ovulate.
Right.
But in PCOD, because your LH levels are higher than your FSH and your androgen levels are very high, we don't see that ovulation happening at all.
Okay.
So in that case, what we see a lot of women who failure to ovulate.
I see.
So that is considered as anovulation. So they definitely need help. And the second category is your hyporesponder. I mean, we all know that at the age of 35 plus, their response is very less. But nowadays, we are men who come to us even at 25 years, and still you don't see the expected response what you're supposed to see. So I think you must be aware of the Posidion classification for poor responder. So we see a lot of these women who actually don't respond as we think they do. So that is also failure to ovulate.
Respond to fertility treatments?
Exactly, yeah.
Right. So age aside, I guess now with lifestyle choices, younger women also have got a lot of issues.
Exactly. I mean, I have treated 25-year-olds with DHEA.
What is that?
The anti-rejuvenation drug which we give, right? The CoQ and of course the diethyl androstenedione. Those are androgens which are coming up for poor ovarian reserve, especially women who are above 35. I mean, in my practice, I have even given it to the 25-year-olds because their response is so poor. When I stimulate, I'll be expecting around, say, at least around 7 to 8 oocytes, but I hardly get 3. So they all have an issue.
Definitely is a concern now.
Exactly, yeah.
And what exactly is primary ovarian insufficiency?
That is your primary ovarian insufficiency is when you have an ovarian failure at even a younger age. So when we see POI cases, first thing we think of is chromosomal anomaly like Turner syndrome.
Okay.
So primary ovarian insufficiency is basically the women are going for an ovarian failure or premature ovarian failure at a very early age.
Right. So let's suppose a woman who is around 35 years come to you with the issue of with fertility issues. So what would be the first step you would do as a doctor?
At 35?
At 35.
Yeah. 35, then definitely you cannot go slow. So you have to, do all the investigation. I will do a scan to see her AFC count, that is her antral follicle count. Then I will do blood test. So then I'll be doing her, what do you call, FSH, LH levels, then her semen, and for the male, definitely I'll ask for semen analysis.
I see.
Then I'll see her tubal patency, and then I'll to go ahead for treatment as soon as possible.
So no delay, just straight away start treating both the partners.
Partners, exactly.
Can't be that the female is all right and you're just treating the female.
Exactly.
So, okay, so that's 35. Now coming to 40 years of age. If I am 40 years of age, what are my chances of getting pregnant?
Your chances of getting pregnant is around, say, I think around 50%, but the chances of you having a healthy baby, that is the issue. Because at 40 years, we are more worried about chromosomal anomalies like Down syndrome. So we are worried about those issues.
So having a child, I've got around 50% if I'm 40, but having a normal child is a bigger concern.
Exactly, because of chromosomal anomalies.
That is so scary.
Exactly. Because we have women who come to us at 40 years, they do have a trisomy 13. It's common.
Would you recommend a home insemination kit to your patient?
Home insemination kit. They should be educated
on how to use it.
Exactly, because I am from the rural area, so it's very difficult for me to educate them.
Right.
That is one thing, and it's the same thing. I think they should be educated and well versed to use it on their own, because I even have people who come and complain to me that when they put the vaginal progesterone, it comes out. How do I put it? Tell me, how do I put it? And they even come to me, can you please put it? So it's like that.
So what can we do together to educate people about how to use home insemination kit?
Just like how they used to do the pregnancy kits. I mean, everyone used to come to the hospital to get a pregnancy card, right? But now it is over the counter. So it's mainly patient education.
So seminars and workshops and all those things?
And camps. and yeah, like those. Where you have the general public. Like initially, how the tampons became famous. Not, only the educated crowd, they know how to use it correctly. But, the subnormal people, they still don't know what a tampon is, or even that cup, silicone cup. Not many people are aware of those.
Right. So it's only through workshops and more of educational purpose that
Exactly.
Well, Dr. Gayatri, it's been very informative. Thank you so much. May God bless you and your clinic. And we wish you the best from Subak Health Tech.
Okay. Thank you so much for the opportunity.
Oh, it's our pleasure. And we are so humbled that you would agree to come and do this show.
Okay. Thank you so much.
All right, then.